Hi, my name is Aziz, and in this particular presentation, I'll be reporting on some joint work with Florian Brandl on the topic of healthcare rationing. So this is very much a market design presentation or a project. And the fundamental question that we're looking at is who gets what and why, especially in the context of healthcare rationing. So the idea is that there could be scarce or costly resources such as ventilators, vaccines, ICU beds, and antiviral medicine, and this issue of making allocation decisions about which particular person should get an ICU bed, for example, has been referred to as one of the hardest questions that doctors may have to face. Similar kind of concerns also come out in the issue of vaccine rollouts, for example, which particular groups should be prioritized when rolling out vaccines has been discussed a lot in the public domain. So we are not the first to look at this issue. People have been looking at this in a very formal and high-level manner, especially in the context of medical ethics. I give one particular example, which is the Sydney Health Ethics Framework, especially as a response to COVID last year. And three particular values or principles which were outlined in that particular report included equal value for all, getting the most out of resources, and giving priority to those in need. And when one looks at many of these ethical frameworks, one general principle that is often highlighted is that it's very important to acknowledge the various implicit and explicit priorities that influence the process and develop a decision-making tool that incorporates these various ethical principles. So the idea behind this particular project is to make these allocation decisions in a principled manner, which also takes into account various ethical priorities and principles. So as far as priority groups are concerned, I just give a few examples, especially in the context of vaccine rollouts. In policymakers, they often want to prioritize healthcare workers. They may also want to prioritize elderly people or prioritize people who most urgently need a healthcare resource. So the question that we're looking at is how do we allocate scarce medical resources fairly and efficiently while taking into account various ethical principles and priority groups. So we're not the first to look at this from a formal sense. As far as making or designing particular rules is concerned, there was a paper which came out last year by a group of prominent economists who took a market design approach. They took a matching market design approach for this particular problem. And their way of formulating the problem was that there are a set of agents or patients, it's just referred to as agents in a more generic way. And there are a set of categories on the other side. And these categories can be seen as dividing the healthcare units among these various categories. So each of these categories has a certain capacity or a certain number of healthcare units. And each of these categories also has a priority ordering over the agent set. This priority ordering specifies which agent is of higher priority than another agent, and it also gives information about which particular agents are in fact eligible for using that particular category's healthcare units. So let me just give a simple example to exemplify this setting or model. So in this particular example, you have three agents on one side, you have two categories on the other side. Each of these categories has a capacity of one, which means that there are a total of two healthcare units to be handed out, but each of these categories has its own priority list over the agent set. And this priority list also specifies which particular agents are in fact eligible for that particular category. For example, in C1's priority list, 2 and 3 are eligible, whereas agent 1, which comes after the empty set notation, is ineligible for using category C1's healthcare unit. So the idea is that we want to look at it from a matching point of view, and we want to find some desirable matchings. So when this work came out, the authors, they also have a corresponding website which keeps track of policy impact, news coverage, and so on. And let me just say a few words on what particular rules they came up with. So one of their formulations was this idea that although agents are completely indifferent among which healthcare units from which particular categories they want to use, but if we artificially make the preferences of agents over categories as strict, then what we have is a case where one side has strict preferences over the other side. The other side, which is the categories, has strict priorities over the agent set. And by having this formulation, we can easily implement the deferred acceptance algorithm. And what these authors, they realized was that this particular algorithm, deferred acceptance for this particular setting, it still satisfies nice properties in this healthcare rationing domain. In particular, it satisfies compliance with eligibility requirements, which means that agents only get a healthcare unit from a category they're eligible for. It also respects priority of categories, which means that you don't have this situation in the middle of the slide where agent I is unmatched, agent J is matched to category C, but agent I has a higher priority for agent J for agent I than agent J. And finally, we want the matching to be non-wasteful, which means that no unit should be unused, but could have been used by some eligible patient. So this was already nice because these three axioms are satisfied by the deferred acceptance formulation of Pathak et al. But secondly, Pathak et al. Already also presented a smart reserves rule, another rule which smartly makes decisions about which particular unit of which particular category should be given to an agent. And making these smart decisions, it finds a maximum size matching, which allocates the maximum number of units to agents who are eligible for those units. One assumption that the smart reserves rule makes is that it's based on some consistency requirements among the priorities. So just to summarize, these were the properties satisfied by the two respective rules in Pathak et al.'s paper. Whereas the deferred acceptance, it handles heterogeneous priorities. The smart reserves rule does not handle heterogeneous priorities, but it does give a maximum size matching for a restricted assumption. So the idea behind our particular paper is that we want to satisfy all these properties as well as some additional properties while not having any disadvantage in our rules. So the question that we're looking at is how do we address the same question that Pathak et al. Were examining in the context of healthy rationing with heterogeneous priorities, and we achieve all these desirable axioms that policymakers are after. One particular set of rules that or axioms that we also look at include some incentive issues. So our rule has been designed in a way so that it does not incentivize agents to lower their priorities in categories or for that matter, hide their eligibility for a particular category. So our main contribution in this particular paper is a rule which satisfies eligibility requirements, priority of categories, maximum size matching, non-wastefulness, and it also satisfies strategy proofness and polynomial time computability. So I haven't given you the rule. You're encouraged to look at the paper. But just to conclude, in this paper, we presented algorithms for healthcare rationing. In some follow-up work in the same line of the project, we also present some characterization results, which characterize that our rule is characterized by some desirable axioms. Our results also extend to the case of soft reserves, which is using these eligibility requirements in a soft way. And finally, I'd like to mention that our rule is framed in the context of healthcare rationing, but it also applies to various other rationing problems, including algorithmic hiring, immigration, school choice, and various allocation problems which may come up. I thank you for your attention, and you're most welcome to reach out to us by email if you have any questions. Thank you.